Yeah, so we're live.
Okay.
All right. So, good morning. Welcome to Doc Talk Live. It's been a couple weeks since I've been able to do a Doc Talk Live. I appreciate y'all bugging me and trying to stay on me to do these. We need to keep doing them. If you have ideas, feel free to send them to Doc Talk Live. This morning, I'm with Greg Gullung. Greg, great to have you. Thanks for coming in. Greg is a spine surgeon. And we're going to just talk briefly today, just for a few minutes, about a specific area of spine surgery, which would be minimally invasive spine surgery. We're in an outpatient facility, an outpatient surgery facility, and so the obvious question is what type of patient can get a really minimally invasive outpatient back surgery?
Sure.
As opposed to having to spend a night in a hospital and getting a bigger operation.
Right. So a lot of the procedures can be done in a minimally invasive fashion. And what that simply means is you're trying to do less tissue damage when you do these procedures. So a lot of the small things like single level disc herniations in the neck or in the low back can be done in an outpatient setting safely. And that's the key. You want to make sure that it's a safe situation for the patient. And if you can do that in the outpatient setting, it's much more convenient and it's much less problematic.
Tell us, what is the technology involved? Has the technology changed over the last 5 or 10 years to sort of evolve this into a more minimally invasive setting? How do you do less tissue damage?
Sure. The traditional surgery, you make a midline incision, you open everything up, you pull the muscle away from the bone, put in retractors, and you're kind of looking at a big open hole. Whereas now there are a lot of different techniques where you're using microscopes, small tubes, much smaller incisions, sometimes even endoscopes, where you're actually doing it through 1 centimeter or less incisions. That way you're not just destroying as much muscle, and that of course creates much less pain as well, which is great in the outpatient setting.
I pulled up an image of a herniated disc, and maybe you could. What I'll try to do is, let me see if I can turn this around. I don't know how you do that. Isn't there a way of turning it? There you go. I'll turn the camera around. Let's see if I can just show. So, show the audience a herniated disc.
Sure. So we have two views here. This is a side view of the spine, and this is a top-down view. So this is the disc up front. This is the spinal canal through here. And in this picture, here's the disc up front, and this is the spinal canal. So in these pictures, you can see the herniated disc. Right there, you see this light gray material back in the spinal canal. That's the disc material that has popped out and moved up a little bit.
Okay.
Versus this area where you see there's nothing behind that disc.
Right.
On this picture, you can see it as well. If you look at this side, this is normal. You see that white area, that's the space where the nerves can exit. And this little dot here is an actual picture of the nerve. Whereas on this side, you can see, again, that gray material right here is that disc that has popped out and is displacing that nerve posteriorly, causing the pain.
Now take us through a traditional surgery versus what we can now, or what you can now do through a minimally invasive approach.
Sure. So one of the traditional ways is you make an incision in the back. All of this is the posterior muscle, and you have to peel that away and gain access to this bone here. Then you have to trim away some of that bone, trim away some of this joint here, which of course causes some native tissue destruction, and then you can get to this disc, take it out. You have to sew that back down, sew up the skin, and then people can go home still. However, a new way to do it is what we do is we come from the side here, and if you see on this approach, if we take this angle, you can get to that disc just by simply going through this muscle without having to peel it away or cut any bone, and that gives us access to the disc itself. We can take that piece of disc out without having to trim away any of this bone or cut that muscle.
I'm going to go back. Okay, so we'll back up again. All right, I think that was a great explanation. So now we can get to that. You can get to that material. What's the recovery versus one versus the other?
Sure. So one of the things that whenever you peel that muscle away, you have to let it heal. And no matter what you do, it takes about 6 weeks for that muscle fascia to heal, which is the covering around the
So
muscle.
traditional surgery, we're
Traditional
looking at
surgery.
6 weeks.
At least 6 weeks.
And what type of activity restrictions?
So really, light bending is okay, but you don't want to do any deep bending, no heavy lifting.
Drive?
So
Can they drive?
driving's okay.
Okay.
Driving is okay after a few days or a week or so.
Okay.
With the less invasive options, you're not doing that muscle damage, that destruction. You still want them to be careful because you want that disc area to heal. But generally, with the pain being less, people can get back up, within a day or so, go back to work. They can drive.
How about playing sports?
Sports, depending on what it is, but you probably still want to wait about 6 to 8 weeks before you try to play sports.
All right. I'm gonna leave it at that. Greg, appreciate you doing this, and
Yes.
hopefully, Greg's gonna try to tape a surgery. Maybe we can post it later so they can see that. Greg,
Okay.
appreciate it so
Yeah,
much.
it's good
Thank
seeing
you
you this morning. Thank
Appreciate
you.
it. Thanks for doing this.